All right, welcome everyone. I'm excited to invite you to a faith and wellness community series, a three-part virtual event designed to help our community live well in body, mind, and spirit. As a ministry, this is our first time hosting an event like this, and here's a reason why. We see real needs in our community. Adults of all ages are navigating health questions, medication, stress, and life transitions. We believe God wants his people to thrive throughout their whole lives, not just spiritually, but physically and emotionally too. This series brings together trusted medical and wellness professionals that are faithful stewards over their faith and their profession. Here's a chance for us to all learn and grow and become wise and make informed decisions so we can live a long and prosperous life in God. So I'll introduce our speaker this evening. But first, tonight's topic is medication wisdom for every adult, staying safe and informed. This session will be presented by Dr. Rene Williamson, and she will equip us, all adults here of all ages, to understand medications, supplements, and their interactions. And so I'll read her bio. Dr. Rene Williamson is a believer, child of God, daughter of Zion, and prayer warrior. Dr. Williamson is a retired clinical pharmacist. She attended Howard University, where she received her BS degree in pharmacy and pharmaceutical studies. Later, she received her Doctor of Pharmacy degree from the University of Maryland School of Pharmacy. Dr. Williamson has practiced in various facets of pharmacy, pharmaceutical sales, retail pharmacy, drug information specialist, project manager, director of quality control, pharmacy director, oncology pharmacist, and specialty clinical pharmacist. Today, she maintains her Maryland state licensure. Dr. Williamson is a member of the Church of New Beginnings. She serves in the prayer ministry and is on the board of directors. And she wants us to share these scriptures because these tie back her, and she'll talk more about this, but this ties her profession to the Bible. In Exodus 30, verse 35, it says, "And thou shalt make a perfume, a
Perfect.
confection after the art of apothecary, tempered together, pure." And another scripture in Exodus 37:29, and the he made the holy anointing oil and pure incense of sweet spices according to the work of the apothecary. So I introduce to you apothecary, pharmacist, Dr. Rene Williamson. Thank you.
Hello, everybody. Glad to
Hello.
have you on
Hi.
board. And I wanted to share that scripture with you so that you will know that the Lord Himself created um, the apothecary or the profession of pharmacy. It's not new, just like they had physicians in that day, they also had pharmacists. And when I found that scripture, it was doing a Bible study teaching with Bishop on the tabernacle. And I just, was like, wow, this is amazing. And prior to that, I want you to know that I was really not too thrilled about sharing with everybody that I was a pharmacist because at that time we believed in, well, we still believe in supernatural health, divine health, and not having to go to doctors, that we could speak the word and supernaturally be healed. And so if someone was on a medication, a lot of times they would tell me, the doctor wrote the prescription, but I didn't take it, or, this happened, that happened. So I felt like maybe I was out of order. Maybe pharmacy wasn't really approved by God. And so when I found those scriptures, or when the Lord revealed those scriptures to me, I knew then that my profession had been approved. So I'll say that. Okay, so can we go to the next slide, please? So this talk is medication wisdom for the aging community, promoting safe, smart, and healthy medication use. Next slide. Here are some key facts. Nearly 90% of older adults take at least one prescription medication. Many take five or more medications daily. Medication errors are a leading cause of emergency room visits. Safe medication practices improve independence and quality of life. The takeaway is knowing your medications can save your life. Next slide, please. Know your medications. Keep an updated list. Include prescription medications, over-the-counter medications, vitamins, and herbal supplements. Make a record of your medication name, the dose, the purpose, the time taken, and the prescribing provider. If you end up in the emergency room or an urgent care facility, they may want to call the doctor. And if you have more than one physician, if you have a primary care physician or a specialist, um, we need to know who really prescribed this for you. And sometimes you can go to your primary care and you ask them to renew your prescriptions. They'll renew all the orders, even though they may not have been the initial prescriber. So make sure you have the right name on the bottle. Okay, the other thing is we want to take our I'm sorry, the next slide. We want to take our medications correctly. Best practices. Take medications exactly as prescribed. Never skip or double doses. Never skip or double doses. When I say skip, I mean intentionally skip. Sometimes you can forget. That happens. But if you forget, then you need to determine if you should take that dose right at that moment when you remember, or if it's too late in the day to take that dose. Let's say you're taking something twice a day and you realize that you didn't take your morning dose. And so when the evening comes, you may not want to take two doses at the same time. Just take the dose as prescribed, one in the morning, one in the evening, or if it's twice a day. And the reason I say that is because in some cases, you may be able to take two pills safely and there won't be any side effects. And in other cases, depending on the medication, you can take two doses and you will have a side effect. So if you're not sure, you can always call your pharmacy and ask them, is it okay? Since I missed this morning's dose, can I take two? Or is this one that I should just skip the missed dose and resume my prescribed directions to the next day? Okay. Now you can use pill organizers or medication reminder apps, or you can set alarms on your cell phone to remind you to take your medication. And you want to read the prescription labels carefully. Sometimes it'll tell you to take with food or take on an empty stomach. It may tell you to avoid dairy products. It may tell you to avoid taking this with grapefruit juice. And these are simple interactions that can affect the way the medication is absorbed. And it's really based on your diet or what's in the stomach at the time. So let's say you have something on the bottle that says don't take with dairy or avoid dairy within a certain time period. And that's so that the medication can be absorbed properly. Maybe this is a medication that when it combines with a dairy product, the key element, calcium, will bind with that medication and will not be absorbed. It could be a wasted dose. So just look on your bottle and look for all the different alerts that may be on the label itself. And again, read the prescription labels carefully. Reminder, never stop a medication without consulting your healthcare provider. If you have a reaction, you need to notify the physician so that can be entered in your chart and they will instruct you to maybe change the way you're taking it, ask you, what did you take with it? A lot of times we take all of our medications first thing in the morning. We just put all the pills in our hand and we'll have maybe 5 or 6 pills and we'll just swallow them all down. And there may be an exception to that where some of those medications shouldn't be taken together. And so if you have a reaction, you want to let the healthcare provider know. Again, you can ask your physician or you can ask the pharmacist or the nurse in the office, the nurse practitioner, the physician assistant, to, confirm, did I take it correctly? Okay. All right. Next page. Avoid dangerous drug interactions. Be aware. Interactions may occur between prescription medications, as I just outlined, over-the-counter medications, vitamins, herbal supplements, alcohol. And when I say over-the-counter medications, that could be something as simple as Tylenol, that can be a cough medication. There can be some things that do not require prescription authority that you would take with your prescription medication and it may interact. Also, some vitamins. Some vitamins you don't want to take, like iron pills, you don't want to take with certain prescription medications. And again, herbal supplements. And with herbal supplements, we have to be very careful because when we do studies to check for drug interactions, we may do combination or what we call head-to-head studies. We'll compare drug A or chemical A with chemical B. And when herbal supplements are um, released to the market, those types of studies have not been done. So we only know through observation what those side effects could be. And so let's say you're taking a medication for cancer, an oral medication. An herbal supplement could interact with that chemotherapy and could render it ineffective. Or it could react with that chemotherapy and render it toxic. So if you take herbal supplements, I'm not saying you need to stop, but you need to let the prescriber know. I take this, I take that, and so that they can run whatever check they'd like to check in their little personal database to see if any severe interactions have been reported with what they want to prescribe and what you're taking. Also, alcohol. Um, I know some people may not consume alcohol, but there's some people that may want to have a glass of wine every now and then, or um, they go out to a social event and they have a sip of alcoholic beverage. And the problem with that is alcohol can sustain or lengthen the time that a lot of prescription medications will stay in the body. So we definitely advise against you consuming alcohol with a lot of your prescription medications. And in some cases, you will have a reaction that may cause a vomiting upset or stomach upset or GI upset when you combine your prescription drug with alcohol. Again, ask your pharmacist, your physician, your nurse practitioner before adding a new medication. When they say, I'm going to give you something for this, let's try this. You're going to say, well, how about the other medications that I take? Will it interact? Just be very diligent about that, intentional. Okay? All right, next page. Medication storage and disposal. Store your medications safely. Keep the medications in their original containers. If you get mail order delivery and you get 3 bottles of 30 tablets, when you open up one of those bottles, put an X on it or mark it so that you don't open another bottle and have several bottles open at the same time. That's the same medication. It'll be hard for you to keep up with how many you have and when you should place your refill. So try to not have more than one of those bottles open at the same time. Also, you want to store away from heat, moisture, and direct sunlight. Heat can melt the capsules, moisture can melt a tablet, and direct sunlight can also have a reaction on pills that are left out in the sunlight or left in your car, especially during the summer. Okay, so we want to be careful about leaving medication in the car. Also, like if you go out for the day and run errands, and the first thing you do is go to the pharmacy, don't just throw that bag on the seat in the car. Place it in your purse or have it with you so that it's not exposed to sunlight. Also, keep medications out of the reach of children, your grandchildren, your great grands, and pets. Okay. We've had many of instances where people call poison control when their children or their grandchildren or their great grands have gotten hold of their prescription. Also, you want to check your expiration dates on a regular basis. And this is with your over the counter and your herbal supplements as well. Always circle that expiration date so that every time you open it, you'll see that expiration date so that you're not taking expired medication. Now, you may say, well, it's expired, but it still works. And what I want to say to you is that the expiration dates come from the manufacturer, and that date is the date that they guarantee the potency of the medication. After that date, they can no longer guarantee the potency of the medication. It can be still good, but the pharmaceutical manufacturer or the vitamin manufacturer, the herbal supplement manufacturer will not assume liability if you use it past that date. Okay? Also, we want to dispose of our medications safely. There used to be a time when we would tell people just flush it down the toilet. Well, now we know that that water contaminates our waterways. And what we want to do is use our community medication take back programs. Also, some of your retail pharmacies have a little box where you can drop your expired medication in when you visit the pharmacy, and they will dispose of it safely. Also, you can take the medication to fire stations, and they will dispose of the medication safely. And also, when you get your um, little leaflet with the medication, you pick it up, they will tell you how to dispose of the medication if it needs a special way to dispose of it. And the other thing that I want to say is never share medications with others. Even if it's over the counter, you don't know that other person's medication history. You don't know if they have allergies. You just don't have the full picture. So you could really put someone in harm's way if you share medications with them. Okay? All right, the next slide, please. Recognize side effects. Watch for dizziness, falls, confusion, sleepiness, memory changes, nausea, rash, and trouble breathing. Contact your healthcare provider immediately if symptoms are severe or unexpected. And sometimes they will tell you call 911. Sometimes they will tell you go to the store, pick up an antihistamine. But you need to call and get their advice when you encounter some of these side effects. And the biggest one to watch for is dizziness. Dizziness from medication is one of our common causes of falls. And when we fall, we can break a hip, we can break a leg. I mean, we can just really um, ensue a injury that could really set us back. Right now, we're in this season where our independence is always being challenged, and we want to make sure that we use our medications safely and that we can get the benefit from them. So, whenever you feel that something is occurring and it's right after you have taken that medication dose, definitely call your healthcare provider and share that information with them. And they can tell you if it's a severe symptom, like call 911. When 911 comes, they'll be equipped with epinephrine or anything that would be needed to reverse a severe interaction. Okay, let's go to the next slide. Partner with your healthcare team. At every appointment, I want you to bring your current medication list, all of your medication bottles, and your questions that you may have. And not just your prescription medication bottles. Bring your over the counter, if you take Tylenol, Tylenol rapid release, Tylenol for arthritis, Advil, Aleve, any of those things. Um, Zyrtec for allergies. There's so many things that are over the counter, Pepcid for gastric reflux, all these things. If you take any of those things, bring them with you. Also, you want to ask, why am I taking this medication? What did you say it was for? My heart, what does it do? How does it help my heart? Okay, it may help with the heartbeats. Maybe you have irregular heartbeats. It may make them more regular, or it could be high blood pressure medication. It could be medication that you take for fluid. It could be many and various indications, but you should know when you take this medication what you're taking it for. Also, you want to know what are the possible side effects. Okay, is it going to make me feel woozy? Is it going to make my ankles swell? Is it going to upset my stomach? Is it going to give me a headache? Ask all those different things so that your healthcare provider can share that information with you. And then you can ask, are there lower cost alternatives? Let's say your prescription plan pays for it, but because it's not on their list or it's not formulary, your copay is higher. Could he prescribe, or could the prescriber, not necessarily he, prescribe a medication that would be not as costly as far as your copay is concerned? Also, are there any medications that can be reduced or discontinued? Sometimes you may have a side effect, and it may be that maybe the medication or whatever is being treated, you are getting a good benefit, or maybe you've lost some weight and maybe the dose can be reduced. And maybe some of the side effects that you're feeling may be because the dose is too high now. When it was first prescribed, let's say you weighed a certain amount of weight, and because of this regimen, let's say the medication may be a diuretic or a fluid pill, you've lost some weight, and now the medication, you're having some side effects, and the doctor needs to know that, and they will reduce it or say, okay, let's see how you do if we stop it. If the swelling comes back or if this comes back, call me and we'll start it again, but maybe at a reduced dose. Okay? All right. So the next one is medication wisdom tips. Remember the safe rule. Store medications properly. Ask questions. Follow directions. Evaluate your medications regularly with your healthcare provider. And one thing that I want to emphasize, when you step up to the counter and you get that medication and pay for it. Open up the bag and look at the bag and make sure your name is on the label. Sometimes accidents happen in the pharmacy and maybe you get somebody else's medication. Right now, that should not happen because we barcode everything. Everything is barcoded, and if it doesn't acknowledge the barcode, then we know there's been a breach somewhere in the system. Either the wrong drug was pulled or the wrong label. The label belongs to somebody else. All of that has been checked before we can bag the medication. But you don't want to go home and then when you open the bag, instead of it saying Rene Williamson, it's saying Susie Johnson and you're like, what in the world happened? Okay, so I always tell people check the bag before you leave the prescription counter. And also make sure it's what the doctor told you you would get. He may use a brand name, but your prescription plan requires a generic name, and you may not recognize that generic name. So you want to confirm with the pharmacist. He told me that this is going to be drug A, but this is drug B. And the pharmacist will confirm, yes, this is generic for that drug. Okay. Also, healthy habits also include eating a balanced diet, staying physically active, drinking plenty of water, and scheduling regular medication reviews. Now, when I say drinking plenty of water, you should be drinking like maybe four of these bottles of water. This is 16 ounces or 500 mLs. Um, unless you've been told to limit your fluids. And if you've been told to limit your fluids, then limit your fluids. There's some conditions that we don't want people to drink for those bottles. So make sure you have an understanding with your prescriber how much you should consume daily. The other thing that I want to mention is the directions. Let's say your doctor says take one tablet twice a day. And you may say, okay, that means 12 hours. So if you get up in the morning let's say you get up at 8, but you may not eat anything or eat your breakfast till maybe 9 or 10 o'clock. So you're going to take your first dose and then maybe later on that night at 8:30 or 9 o'clock, you're sleepy, but you're going to stay up 12 hours so that you can take the second dose. You don't have to do that in many cases. In many cases, you just need to at least have an 8-hour span. Don't stay up and lose sleep because you feel that you have to do exactly 12 hours. On the other hand, don't take one in the morning and then take the second dose at lunchtime. Give yourself time for the drug to enter into your system, be properly absorbed, and let your organs do the metabolism or elimination that is adequate so that you're at baseline for your second dose. Um, we used to sometimes doctors will say every 8 hours. They'll actually give you hours. They'll say every 12 hours, or they'll say twice a day or 3 times a day. So we tell people to dose that around their meals, especially if you eat 3 times a day. But if it's a medication that says take on an empty stomach, then you're going to at least take it a half an hour before you eat. And you can also take it during your meal, or you can, well, if it's one that you can take with food, you can eat a little bit, then take your medication, or you can eat your entire meal and then take the medication afterwards. It's not really a hard and fast rule. Okay, next slide, please. Okay, now, medication wisdom begins with you. Helpful resources, your healthcare provider, your local pharmacist, Also a local area agency on aging, and also community health education programs, just like the one we're doing tonight. So at this time, I want to thank you for listening to my presentation. I want you to take your medications wisely and live healthier and longer. And at this point time in the presentation, I will ask you to raise your hand if you have a question, and hopefully I'll be able to answer that question.
Thank you, Dr. Renee. So we are transitioning into Q&A as she has led you to do. See the slide up, just a brief reminder that we are recording this for online, so please only share what you feel comfortable being in the public. Thank you.
Rene?
Yes,
Yes, great presentation, very informative. Um,
great.
I had a question about, I take vitamins and I get them from different sources. So my question is this, is there a specific source that you would recommend over others? Or
Okay. Okay, go ahead. I'm sorry.
no, I mean that's basically my question, because I like, for example, like vitamin C. Sometimes I use the GNC product, other times it's something else. So is there a specific source that you would consider better, that you would recommend over others?
Okay, I don't really recommend a particular source, but I will tell you that vitamins have to be tested.
Hmm.
Many years, I guess I should say decades ago, a well-known, I'll say one a day vitamins came to Howard University Pharmacy School and asked them to test the formulation for dissolving or
Hmm.
to see if it was absorbed. And when they did the test, they just put the tablet in a glass of water and the tablet never dissolved. So at that point, they knew that it really wasn't being absorbed and they changed the formulation. And of course, I have to say that because they used Howard University College of Pharmacy to conduct that experiment for them. So one of the things that should be on the bottle should be either USP or some organization that has the authority to test and confirm that what is in the tablet is that they have tested it. So it is vitamin C. It
Hmm.
is the strength that it says on the label, and it does absorb once the patient swallows it. So you want to look for USP. It's like USP in capital letters with a circle around it. And there's some other organizations that also test for the potency of the drug. So look for that on the label. And if you have that assurity that it's been tested and it is what it says it is, then you can be comfortable taking it.
Okay, thanks.
All right,
One of
Ren.
the brand, I'm sorry, one of the brands that you have seen maybe commercials about is called Nature Made. It
Yes.
says pharmacist recommended, and that's where the USP designation comes from. So if you can get the USP or the Nature Made brand, that also has been tested.
Okay, thanks. Appreciate it.
Mhm.
So Renee, we have three hands up, India, Zandra, and Ray. So
Oh, okay.
I'm not sure who was first. We're going reverse alphabetical order. Zandra.
Okay, my question is, until recently, when you would get a prescription and the pill or the capsule didn't look like what you had last month, I notice now that sometimes they're putting inside of the bag with it that this medication looks like this or this medication has been changed. So when you if you don't get that notification and you get a pill that doesn't look like what you took last time, should you call the pharmacist just to verify that that's what you're taking?
Absolutely. Now, let me say this. If you still have your old bottle, it should have on the bottle the name of the manufacturer, with the chemical name. Let's say it's amlodipine for high blood pressure. It would have Tiva or some or whatever the manufacturer is. And you could if you see that the two manufacturers are different, then that would definitely confirm that, you just have a different manufacturer. And I would also call just to confirm. I will tell you this, when we place orders for generics, we order, large volumes, especially if you use mail order, it's just unthinkable volumes. And so we try to get the whole batch so that we can go a long time with giving the patient the same pill over a greater length of time, at least 90 days or more, 180 days. But sometimes the manufacturer is not able to give us the full batch. And so that's when you get various different appearances because most of them now it's always white tablets. They may be oblong, they may be circular or whatever. At one time, they would try to make the generics look just like the brand, but now everything is just white. And so if you're not sure, you want to definitely call the pharmacist and confirm that this is the right medication.
Okay, thank you so much.
You're welcome.
All right. So we have Ray.
Yeah, hello, Renee. It was
Hi,
very informative. I appreciate you.
thank you.
The question I have has to do with supplements.
Okay.
There's some people that take multitudes of supplements, but
Mhm.
if your diet is good and you're eating the right foods on a regular basis, should there be a need for supplements for a person?
Well, I will say this. It really depends on their medical history. Um, and when we say they're eating the right things, we always go back to our ancestors, and we have to realize when our ancestors ate, there weren't additives in the food, there weren't antibiotics in the chicken, there weren't chemicals to kill pests and things sprayed on vegetables. All of those things are in our food chain. So there's always a chance that even though they say these chemicals are destroyed when we cook or when we wash, you buy vegetables from the grocery store, they tell you to wash the vegetables, even though the bag says pre-washed, all those things. We don't always know if we are absorbing everything at its highest quality. And also, we could have some underlying issues in our stomach tract, I say GI tract, gastroenterology tract, that's your stomach, your small intestines, where you do a lot of the absorption of vitamins and minerals and nourishments. It just may not be optimum. And so there may be issues with absorption. Now we're also learning that we have to maintain a certain bacteria level in our gut so that our gut works perfectly. So there are a lot of different um, cases where you may not be absorbing um, uh, the things from your food, and your physician can determine that based on some of the things that you complain about. You may say, well, my skin is dry, or my hair is thin, or um, um, I feel this way, I feel that way. And they may be able to determine that they need to run some type of test that may measure levels. And then they may instruct you, okay, I want you to start taking vitamin D. I want you to take iron. I want you to take, what are some of the other things? Other vitamin supplements. Or you may not even be eating enough, and they may give you some type of like boost or ensure to add to your calories. So I would say you may you just can't say because you're eating that you are absorbing everything to its fullest extent.
Good
And
point.
especially
Yeah,
at this, and especially at this season of our lives, our ability to do everything that we did in our younger days kind of slows down as we age.
I got you. Thank you very much, Renee. Appreciate
Okay.
that.
All right, India.
Now, can I ask, Dr. Yolanda is on. Has she left yet or is she still on?
I don't think I see her. I'm going through the
Yeah,
names.
she had another meeting. I think
Yeah, I
she,
don't think. Yeah, she must.
okay.
She just left.
I
She's
was
not
going
no
to
longer
ask
in
her
the
to
list.
comment on that. Okay. All right. And you said it was one other person?
Yes, India.
Hi,
Hi, India.
hi. How are you?
Great.
Good. I know you talked about supplements, vitamins, and and I know that's great. But now, how about these oils and stuff you can put on your feet, you can take and stuff like that? It, they're kind of like, uh, what do I say? Supposed to help your health. Suppose,
Yeah, it's
the
a
weight off.
it's like a holistic remedy.
Hmm.
I have information on different oils, but again, let me just tell you that again, we're talking about observational. These are remedies that have not been tested one to one. In other words, I'm not testing the oil against a prescription drug. These are oils that people have used for different symptoms or things that they're feeling, and they have applied the oil and they get this particular reaction, and it's something that works for them or that they feel is good for them. Now, that may happen for them. It may not happen for me. It may not happen for you. And so that's why. Unless we can do a more in detailed study where we're comparing it against something that we know it works, we can't say it's as good as.
Okay. That's
Now, if you try it, if you use peppermint oil and you rub it on the bottom of your feet and you get some relief, then that's great. A lot of oils like peppermint and mint are cooling, they're soothing. When we go for our manicures and our pedicures, and they give us this scrub and they put the different creams and oil, those things feel good. But it's really more what I want to say, it's more of a local effect. It's not something that you're going to swallow and ingest. It's something that you're just applying.
okay. Now, all this stuff that's out on YouTube about you can have worms and this, that, the other. Do you recommend any of that?
No, I do
They
not
stay away.
recommend
Okay.
anything from YouTube. That person that put together the video may be a physician or he may claim to be a physician. If you want to know things like that, there's certain websites or libraries that medical professionals use because their research is researched by our peers or by people who are doing what do I want to say? What's the right word? They're doing proper research. And you can find papers, you can find articles or reviews, but a lot of that you probably will not understand because it's written in a scientific manner. And so, a lot of people will interpret that, but it may not be the correct interpretation. You can always, if you find articles and you're not sure, you can always take that into your physician as well and ask them, what do you think about this paper? Leave it with them, or they may be familiar with them. They may agree with that, they may not. A lot of your physicians belong to, they're certified, they're accredited, they have accreditation in their specialty, they have meetings and they meet with their peers and they devise treatment guidelines, and these are things that have been well studied and well thought out. So I wouldn't recommend getting advice on YouTube about what you should ingest without doing some proper research. And you would have to go to medical libraries. You would have to be on PubMed and things like that to really research those articles.
Thank you.
Okay.
All right, we have a question from Dolores.
Hi, Dolores.
How you doing, Sister Renee? I
Great.
have a question about cortisol and collagen. Um, the doctor was saying something about cortisol levels are low,
Mm-hmm.
and then this big phase about collagen. So I'm trying to
Mm-hmm.
understand them. Could you expound on it?
Okay, now when he said that the cortisol levels were low, what is it that he's comparing it with, or what, if I could ask, what were some of the symptoms? Does it have to be with weight control, weight loss, or um, feeling hot, feeling cold? What are
And
some of the symptoms?
the sciatica pain and the nerve that I'm
Okay,
on the right side.
are you saying cortisol or cortisone?
Oh, I didn't know there was a difference.
Well, cortisone is like a drug that's anti-inflammatory. Cortisol is a chemical that the body produces that
Uh-huh.
also works for inflammation.
Yeah,
So if he's
cortisol. He said cortisol.
Okay, so if he's saying it slow, he may say that your ability to repair yourself against this inflammation, you don't have enough of that chemical in your body to fight against it. It's something that the body will normally release. So that's when we get into cortisone injections or anti-inflammatory medications, and that
Mhm.
will help the body. You may get prednisone, you may get something over the counter like Advil and Aleve are anti-inflammatory. There, we can use agents like that to help us fight against the inflammation.
Okay.
Now, um, the other thing about inflammation, it also can occur with our diet. And I think Dr. Yolanda spoke about that last week. Some of
Mm.
the things that we consume will lower those levels or will fight against our body's own normal um, instinct to try to reduce the inflammation. So we have to be careful what we're consuming. And you know, if the doctor feels that additional medication should be administered, then, you can ask questions to feel if you're comfortable going that route. Now, the collagen, I have to tell you, there are a lot of collagen powders. Again, I think you should make sure it is what it is. And also, I I have to tell you, I'm not really sure it's really effective. There's um, a school of thought that if you replace a lot of things in the form of supplements, that we can correct what our bodies normally do. And it's a theory. It may not be proven research. Again, it could be observational. So I would just say if your doctor didn't ask you or didn't give you strict instructions to start taking something like that as a supplement, I'm not sure you would want to go that route either.
Okay. Okay. Thank you.
All right.
Yeah, I do see one hand up. We'll pause on that hand. We're going to go ahead and end the video and go on the other side, and maybe you can ask your question. Then I am mindful of the time and people's
Okay.
commitment. So Thank you all for attending. You can keep your hand raised, but thank you all for attending. Thank you, Dr. Rene, for this presentation. It was very informative, and you can see a lot of love in the comments. Very thoughtful and beneficial. A lot of great things people pull from this. So thank you so much.
Okay, thank you. I'm really glad that, you received something from it. And if you have any questions, you can always reach out to me.
All right.